So happy to be here at ASH this year, my first ASH. It's quite, first of all, I'm Elena Dela Rosa. I'm a nurse practitioner at City of Hope in the hematology, specializing in lymphoma, specifically CLL, mantle cell, and DLBCL. I work with the two expert physicians on these diseases, Dr. Dalov and Dr. Kamampati, and I really feel privileged, to work with two brilliant doctors. So far, my experience at ASH has been wonderful. Been learning a lot and about, what is the current best treatment strategies for our patients, and also what are the exciting upcoming treatments for our patients. And it's really good to hear all the presentations from the experts around the world. I think that's amazing. I'm getting a lot of valuable information that I can apply in my practice as a nurse practitioner, and which, mostly to kind of educate my patients on what is the best current best and upcoming treatments for their disease. Yeah, so this is a very amazing and very exciting conference, because it cover, if you practice in hematology, for example, you can get a lot of good information, not only with the disease that you're treating or managing, but also different strategies on how to manage and take care of your patients. It's so good to hear from all the experts, experts in the U.S. and globally, on what they are working on towards the ultimate goal of what is the best treatment for our patients, and what would benefit the patients. I specialize in managing patients with CLL, and also now just started working with Dr. Kamampati, who treats a lot of the more aggressive lymphomas. So now I have a whole spectrum of the very indolent type of lymphoma, which is CLL, and on the other spectrum, end of the spectrum, the more aggressive lymphomas like DLBCL and relapsed refractory follicular lymphomas. I see patients in the clinic with my doctors, but I also have an independent nurse practitioner clinic. So I get to follow up my patients. I have the more stable patients who just need monitoring and monitoring of their disease, and sometimes if the doctors are away, I see those patients for them as well. So I think the knowledge that I would gain here from ASH, listening to all these wonderful presentations, would make me a more competent nurse practitioner, would have more knowledge and more things to share with my patients when I see them in the clinic. I really encourage nurses and nurse practitioners to come to ASH. It's not just gaining knowledge or things that we don't normally hear or encounter in our day-to-day practice, but also to network with other healthcare professionals out there from around the world. Yes. And there are also classes that are not pertaining to patient care per se or management of patients, but There are sessions or classes that help you take care of yourself, because I think that's important. To be an effective care provider, I think it's important that we also take care of ourselves. So there are sessions that are geared towards that, about self-care, how to take care of ourselves, to be more effective care providers out there.